This video is part 2 in our series on soft tissue-based shoulder injuries, where we will be covering the palpation and functional-based treatment of the posterior shoulder capsule. Well, what's up, everybody? For those of you that don't know me, my name is Dr. Matt Maggio. I am the creator of the 𝘗𝑒𝑒𝑘 method and the founder of the soft tissue revolution, where we teach manual therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthy and help more people get out of pain. This video is part 2 in our 4-part video series on soft tissue-based injuries of the shoulder. In the first video, we went over the clinical presentations and functional-based testing, specifically of the ligaments and the muscles. If you're watching this on YouTube, I'm going to link it up right up top here. If you are watching this on Facebook or LinkedIn, it's going to be in the comment sections below. So why is the capsule so important in the shoulder? Really, it provides stability, it allows the muscles to anchor to that, and it allows to keep it really stable. So anytime you're moving it or pressing it or trying to use it, that shoulder really wants to hold that humerus right into the joint there of the scapula and keep it from going too far. It really just kind of weighs it all down so it doesn't get too far out in different places and puts you in a bad spot for an injury. So why does the capsule get injured? Because over time, with overuse, maybe sitting on your butt too much and looking forward, not moving enough, that capsule actually gets stretched too much. And when it gets stretched, it doesn't get enough blood flow, it doesn't get enough oxygen. And what happens over time is the body actually starts to lay down scar tissue in the capsule to kind of buffer it and take some of the pressure off of there. Then what happens is it puts more pressure on everything else around there. It puts pressure on the tendon, puts pressure on the muscle, puts pressure on the nerves, puts pressure on the cartilage, and then a lot of other things start to happen. But the capsule really sets the tone of how the shoulder is going to move. It's kind of like the alignment of a car, and when that goes bad, then it puts more pressure on everything else, and that's what kind of gets beat up. So the capsule is usually the first thing to start. Doesn't the capsule get noticed right away? A big thing is it's just not very highly innervated by nerves or blood vessels. It doesn't get a lot of that in there, so the body doesn't really notice that. It's not getting a lot of pain receptors and a lot of feedback like a muscle or a nerve entrapment would cause. So it kind of just hides under the surface, and then you really don't notice it as it's going on. It takes a very long time to heal. Like I said before, it doesn't get a lot of blood flow, doesn't get a lot of oxygen, so it takes a long time for it to heal. It also takes some time for it to build up and cause some of those problems in there as well. In the first video of this training, what I want to share is an advanced palpation of the capsule itself and finding landmarks and really slowing down and making sure you get right to where you need to go, because if you can't find it, you sure as hell can't fix it.
I like to palpate the capsule. It's coming a little closer for me. Is I'll take this arm right here and let it relax. And then essentially what we want to find is some landmarks in here. So I find things that I know. I know this is the humerus, and then essentially where the capsule lives is right between the posterior delt and where the tricep comes together. Usually what happens when people are trying to treat this capsule is they're too much on the posterior delt or they're too much on the tricep. And that makes a big difference. So you can see I'm sinking in. I know this is bone, tricep, posterior delt. I keep working my way back, until I come into the scapula where everything comes together. And that capsule lives right there. And you can see I can really sink in on it and feel that. If there's tension on that, that's telling us there is some scar tissue in there. And if you find it, get in there, put some tension, put some depth on it, and break that down. But the key is slowing down to find it. It's a structure that is very overused in a lot of shoulder problems.
A couple take-homes from that video. Once again, just slow down. Don't be in such a hurry to want to get in there and do a bunch of treatment. You want to do the right amount of treatment and use landmarks. You can see I really slowed down, separating out the tricep from the posterior delt, using the humerus, getting in there and knowing exactly where I am. And I know I'm spot on it. I'm not guessing, and I can get in there and do the right amount of treatment. In the next video, what I want to include is a treatment demonstration using my treatment called manual scar tissue treatment. I'm going to link that up specifically for the posterior capsule right now.
Now we're going to go through the treatment of the shoulder capsule itself. Make sure you watch the advanced palpation of finding that capsule. It's really key, because if you can't find it, you can't fix it. So the key here is actually going to be client setup as well. They're going to be down on a table on their side, and you want to have everything lined up nice and good. Shoulders are here, hips are here. You don't want them too far rolled this way, too far that way. You want everything to be nice and parallel. And then come around here for me. And then you'll actually see this other arm here. They're nice and relaxed. You want this to be nice and relaxed because the tighter they are, the less effective you're going to get that treatment. So you've already watched the palpation and you know how to get there. So what I'm going to be doing is I'm going to be holding this arm with this opposite hand. And what I like to do is have a little bit of tension when we open up. And the key, as we talked about, was landmarks. Because essentially where that capsule lives is right between the posterior delt and the tricep. And what happens is people are either on the posterior delt or they're on the tricep and they're not effective. So you're going to landmark, as you found in that palpation, and I'm going to find right where that capsule is. And the capsule lies right there. Now the key with a capsule is it's a ligament, so you actually don't want to back off from some of your depth. So what I do is I start here just like this, and I'm approaching this way with my body. And the first thing you're going to do is you're going to get some depth in, and you're not going to back off, and then you're going to set some tension with your thumb. And the key first is you want to bring this motion back just like this, and I'm going very, very slow. And that's forcing that capsule to go. And the first motion when these shoulders are really bad is you're just going to try to get this motion first. That's the first thing that I'm opening up. Good. So the key, as we said, you want to get full depth and you're not going to back out. This is where it needs to go. So you're in here, you're over top, and sometimes if you're having trouble getting some of that depth, you can lean over with your body. That helps you get in there a little deeper, and then you can set your tension just like that. Bring that back nice and slow. We're not in a rush here. As we bring that back, see how that comes back further? And once you get some of that motion, you can slowly drop it with this other one, and our tension is going to be leaning with that body. And when it's really bad, at the end here, I will lean on that for about 5 or 6 seconds to open that up. But the key is the palpation and finding that in the right type of setup for the client. If you do all those steps right, it's going to be a much more effective treatment. So sometimes when a client has really bad shoulder range and you've already cleaned up 𝑡ℎ this is going to make the next key to open up. So sometimes you just got to meet them where they're at. Some people might only have range down to here, and you have to start lower and you have to work through that. You want to find the range where it's the most optimal, but don't force it. This is not one that you want to force. So as we said, you find it, you palpate, you got tricep here, you have delt here, humerus, humerus, humerus. Now we're right on that capsule. And when you find it, it's going to be tender on those people. So let's say we're going to start it right here, and I'm going to get my depth by leaning in with my body. I'm going to get my depth by leaning in with my body. I'm not going to back out. And then I'm going to set that tension just like that. And the first step is we're going to bring this arm back just like this. And you'll feel that pull right away. And we want to get this motion first. Then we'll slowly drop it in. And we're going to hold that for a 5 to 6 count. You're going to get about 5 to 7 passes on that. So the key here is the body mechanics and making sure that that's held good. You want to have this arm be nice and relaxed. You don't want them to be fighting. So you want to hold underneath the elbow, and then the motion is going to be a step like that, and then you're going to lean in as you go.
Well, take homes from that video. Once again, slow down. Use your body leverage. And I want you to understand the idea of doing less treatment passes, but better quality. You know, I'd rather have you do 3 really good passes than do like 10 to 12 really shitty passes where you don't actually get anything done. I want you to get the right amount of depth, the right amount of tension, slow down, focus, and do quality work instead of quantity of work. Recap from this training so far. I continue to talk about it. Be a clinician first and a technician second. So many people reach out and they're like, oh, I want to do this treatment or this technique. It isn't that. It is a system. It teaches you what to do, what questions to ask, using your brain, then palpating, then lining it up and doing the correct treatment every single time so you can get real, long-lasting results. And less treatment. Instead, the best and most effective treatment. And once again, have to continue to say this. In order to go fast, you must start by going slow. So in the next video, in part 3 of the series, we're going to be going through the 𝑡ℎ, specifically function, palpation, and then treatment demonstration as well. If you liked the video, give it a comment, or like, or share. If you got any insights, drop it in the comment section. You know, I always like to read these and share more information and get some feedback from all of you about what you liked, what you learned, or other things you want to have me cover in the future. Go grab our free training. We start with critical thinking, advanced palpation, using your brain, getting you on that journey to be a clinician first, then a technician second. And then if you like all of that stuff, we do offer CEU courses for massage therapists. Those are both available online and in person. Appreciate you guys watching, and we'll see you on the next one. Bye.